I'm Peter Hayweiser, physical therapist. I'm teaching kids about the therapy career as physical therapists and work at Allegheny General Hospital. Thanks, guys. So, like Kristen said, my name is Peter Hayweiser, and I work at Allegheny General Hospital. This little DPT, those are my credentials. They stand for Doctorate of Physical Therapy. So anyone that's thinking about going into physical therapy, that's what you'll be, because now all of the programs are doctorate programs. There's no more master's programs or bachelor's programs. Actually, there might be 2 master's programs, but a lot of people will go to the doctorate field. So we'll kind of get into that, and if you have questions as we're going through things, please raise your hand, please ask. Very informal, and I want to be able to answer your questions when they come up. So just a little bit about me. I went to Bethel, graduated in 2006, a couple years ago there, and then I went to Duquesne University for my college education. So we'll kind of talk about Duquesne's program, because that's the one I'm familiar with since I went there. But in 2010, I got 2 bachelor's degrees, one in biology, one in health sciences, and that's just how their program is set up. I didn't really have a choice as to what I wanted my undergraduate degrees to be. And then 2 years later, your DPT, or your doctorate in physical therapy. So we'll kind of go over how the program is set up and a lot of the coursework that's set up with that. A couple other things. Last year, I became a APTA, which is the American Physical Therapy Association, credentialed clinical instructor. So basically all those fancy words mean that students that are in PT school, part of your education is actually clinical work. So about 20% of it is. So I actually have a student right now with me, and he's kind of teaching him the ropes, and that's what that means, clinical instructor, is I teach out in the field. And Allegheny General, it's a hospital, so it's acute care, which is more people that are pretty sick and need more help. I've been there for 2 years since I graduated. And then just last year, I started also working on the weekends in a skilled nursing facility, which you guys probably know as a nursing home, but they do get therapy there. And I work there casually, so as needed. So if they need me on a one day, they'll say, hey, are you available? And I'll say, oh, no, I already have plans, or yeah, I can come in and help you guys out. And then I just listed here some of my special interests in the field, dealing with people after they've had an amputation and they're using a prosthetic, also spinal cord injury, and any type of neurological diagnoses, especially multiple sclerosis. And CVA is abbreviation for someone who's had a stroke. Okay, it stands for cerebrovascular accident. So just in general about the profession, kind of what we do, and we'll kind of go into this a little bit more, but we diagnose and manage movement dysfunction, okay? So we look at people, how they're moving, what's wrong, what are they having trouble with, how can we help them to get them moving better. Enhanced physical functional abilities, these two kind of coincide because we want to try to get them up and moving. Maybe they've been laying in bed for 2 weeks in the ICU and now they can't even stand. So how are we going to help them get stronger and get better so that they can get up and walking again? And prevent progression of impairments, functional limitations, and disability. Those are kind of big words that we kind of will dive into a little bit more, but impairments are maybe your muscles are weak. Functional limitation is maybe you can't stand or you can't walk because your muscles are weak. And then a disability is, you know, this is like more of the global picture. I can't get around my house because I can't stand, I can't walk. And then restore, maintain, promote optimal physical function and quality of life. So that also is kind of summarizing all of that. Also touch a little bit on a PTA. Some of you might be thinking of a physical therapy assistant. I couldn't get one to come with me today, but we have a couple of them at the hospital. They have a little bit of a different aspect than a therapist does. Their schooling, you can see down here, is only 2 years, and it's associate's degree, so it's not a bachelor's degree. So they cannot do as much as a therapist can, but a lot of people like to do it because they get done with school in 2 years and then they get out working and earning money. But perform treatment interventions. So that's just thinking like strengthening exercises or different modalities like stim and ultrasound and stuff like that. They can do those things. They can implement the PT, stands for physical therapy, we'll see that a lot, the PT plan of care. So the therapist actually makes up the plan of care. We figure out what we're going to do with the patients, we make up their goals, and then the PTA can kind of work the patients through the goals if the therapist is busy. They do have to be under the supervision of a therapist, so there does have to be a therapist there or within like a driving distance in case there's some type of accident or something. And they cannot perform physical therapy evaluations. So that's a big thing, because, especially in the hospital and the acute care setting, because we do a lot of evaluations because patients are moving pretty quick in and out. So going back to the therapist, the physical therapist, this is kind of what we do. We diagnose and treat patients who have medical problems, sometimes, a lot of times, more than one, and we try to figure out how they're limiting their function, and this ADLs is for activities of daily living. So, you know, getting out of bed, getting in and out of the shower, you know, brushing your teeth, combing your hair, all those things a lot of us take for granted. Someone that's really sick can't do any of that by themselves. They need help for all of that. So that's kind of where we come in. We, you know, kind of examine each patient. We talk to them. We get their history. You know, what were you doing before all this happened? How are you getting around? What kind of help do you have at home? How's your family support? How's your house set up? You know, maybe you have to be able to go up and down a flight of stairs, but right now you can barely walk, so that's not really safe to go home. You have to go, maybe have to go somewhere between the hospital and home. System review, that's kind of, we just monitor different vital signs like their blood pressure, their heart rate, how they're breathing, stuff like that. And then tests and measures are, there's a whole bunch of different tests and measures on testing specific strength of different muscles and their coordination and stuff like that. So after we diagnose them, after we examine them, then we establish their prognosis, which is how we think they're going to progress through therapy, and what their optimal goal could be, and their plan of care. And then providing interventions is the treatments, right? How many people have been to therapy before as a patient? Just a couple? Usually it's like everyone puts their hand up and they're like, I was at therapy, so I want to be a therapist. But I was never at therapy. I never had physical therapy, and I'm a therapist. So if you've never been to physical therapy, don't worry. You can still be a therapist. You don't have to receive it to want to do it. So, but the interventions, those are things like if you are therapy, you know, on the machines, lifting weights, you know, getting a little ultrasound with the gel or the stimulation to try to get your muscles stronger. Conduct re-exams. So if we're following them for a long period of time, we do re-exams every maybe like 2 weeks to see how they're progressing towards the goals and what else we can work on. And then modify things if they're not working or if they're not meeting goals. Maybe we have to modify some of our goals to make them more achievable. And then ultimately to develop a discharge plan. Can they go home? Do they need to go to a rehab facility or a skilled nursing facility before going home to get themselves stronger? So this is what everybody wants to know. How much money do you make and all this other stuff. So from 2012 to 2022, so that's 10 years. That's a long ways away. But the Bureau of Labor Statistics says that the median pay is this, which looks great. In case you don't know, that's a good amount of money. However, we'll kind of get into this different depending on where you work, what city you work in, how many therapists there are out there, and stuff like that. That number will change. But this is the important thing here, especially for you guys who are thinking about the field, is the demand for therapists will increase by 36%. 36% is a small percentage, but that's a really, really big statistic, a really big number. And if you want to think of it this way, there will be about 73,000 therapy jobs in the next 10 years that people are going to have to fill. So that's a lot. So the benefits of having a career in physical therapy. Well, you could make a difference. You can really, really help somebody out. A lot of times we'll go into the room and The patient will be laying there, and they've been laying for 2 weeks, and you say, okay, you know, I'm Peter from therapy, and we're going to try to get you up out of bed. And they kind of look at you like you're nuts, you're crazy. But really, once you get them to start moving and then they see that what they're able to do, sometimes you can just really make somebody's day. You become a movement expert, okay? So myself, working in the hospital, I interact a lot with the nurses and the doctors and the physician assistants, and I couldn't tell you how many times in the 2 years I've been working there, people say, this person can't get out of bed, or this person's too weak. How can we get them out of bed? How can we get them into the chair? So you are the movement expert. Job security, kind of like we talked about. Lots of jobs coming, lots of job openings. And then these two little things are from magazines or articles, but the Chicago Tribune Review said greater than 3/4 of PTs report to be very satisfied with their occupation. And in 2011, Forbes said PT is one of the 10 happiest jobs. So whatever you want to take away from that, but a lot of people like it. I like it. And maybe you want to own your own business. Almost 22% of therapists actually own their own therapy practice. So maybe you want to go more towards the business side of it. You want to own your own business, own your own therapy practice. So now here's the salary point. You saw the $79,000, but you know it ranges. It could go from 50 to 80. You know, here in Pittsburgh, there's a lot of therapy schools. There's a lot of jobs with the UPMC, Highmark, Allegheny Health Network, all those places out there. So we, in Pittsburgh, and me myself, we're on the lower end of this, okay? Now, if you went to, I have one of my friends from school, she went down to Texas in the middle of nowhere, and she's making closer towards this. But, you know, you have to kind of take everything into consideration, where you want to live, you know, are you around people you know, stuff like that. So, and she has to pay more to live than I have to pay around here. So that's also something you can look at. So if you're not sure if you want to be a therapist or not, this is the Bureau of Labor Statistics lists the qualities of a physical therapist. So if you think you have some of these qualities, then maybe it's something that you want to do. Compassion, you have to help people. You have to be comfortable touching people to help them, physically help them get up if they're that weak. Detail-oriented, so strong analytical observational skills. Sometimes you'll have people walking and you have to look at how they're walking and figure out what's wrong with them and how you can help them. And dexterity, you have to use your hands a lot, okay? You're using your hands to help people's legs move. Maybe you're using your hands to hold somebody up. You know, you have to be comfortable touching people, which when I started therapy school, I was like, oh, I don't know how I feel about that. I don't want to do that. But as you start to do it more and more, it definitely gets easier. You know, I do it every day. Interpersonal skills, you have to enjoy working with people. You're going to be interacting with patients and their families. You're going to be like one-on-one with them. You have to be comfortable answering their questions because a lot of family members have lots of questions. And you spend a lot of time with them. You know, if you work in a rehab facility, you'll be with a patient for an hour straight, okay, morning and afternoon. So that's 2 hours a day. So, and teaching their family how to help them at home and stuff like that. So you have to be comfortable being around people. Physical stamina, you're on your feet pretty much all day. So all 8 hours of the day that I work, I'm on my feet. I'll sit down a little bit, you know, write my notes and document and stuff, and then get back up and go. Okay, so a lot of therapists spend pretty much all their day on their feet. And resourcefulness, you have to be able to kind of be a little bit creative and adjust your treatment plan. So say you have someone on a treatment plan and then it's not really working, they're not getting better, they're getting frustrated as a patient. You have to be able to adjust that to maybe try to help them and adapt their plan of care. All right, so now about the schooling. So I went to Duquesne, and they have a freshman admission 6-year program. So what that means is I started college as a freshman, and I just went straight through 6 years until I graduated with my doctorate. Some other schools have a 7-year program. Duquesne crunches theirs down to 6 years because once you get into your 4th year of school, you go to school year-round. So summers and everything, you're in school. So it's pretty intense. But I got to go start working a year earlier than some of the people that went to this school. And I have less money to pay for that in my loans. So something to think about if you're interested in it. Or a lot of schools now are doing this 4+3. So a lot of schools, you'll go to, maybe you go to any school you want to, you'll get your undergraduate degree in 4 years, and then you will reapply for graduate school for your therapy school for another 3 years. But if you see where this plus sign is, after you graduate and if you have to reapply, you have to take a test called the GREs, which you can kind of think of as like the SATs, and you have to apply to therapy schools. You're not guaranteed you're going to get in right away. So if it's a field you're really, really, really thinking about doing, I would look for a freshman admission program. If you're not sure if you want to do it or not, then this might be a better choice because you're not making the full commitment. You can get an undergraduate degree, maybe in biology or rehab sciences or health sciences or something like that. See if you like it, and then you can decide if you want to go to therapy school or not after going through 4 years of college. Does that make sense? Okay. These classes here are listed because a lot of times after you get your undergraduate degree, you have to take these courses before you can apply to therapy school. They're called prerequisites.
Would you say that the 6-year and 7-year freshman admit plans, those are for you're really certain that this is what you want to know?
Right. This is for if you're certain you want to do this. Like I went in right after I graduated high school. I knew I wanted to be a therapist. That's what I wanted to do. They're more intense. They're straight through. You have to keep a certain GPA, and you can't get, you have to get certain grades in certain classes and stuff like that. But if you're sure you want to be a therapist, this is the way to go, and it'll save you money and time, because when you have to reapply for grad school, you have to pay to send an application to each therapy school you want to apply to. Does that make sense? So it ends up costing a lot. And this is on your guys' sheet, if you're looking for different therapy schools, there's 218 programs, and you want to look for that little acronym, CAPTE. That's what it stands for. You want to go to a school that's commissioned by the Physical Therapy Association, because that means their program is reliable, it's been commissioned, and their education is what you're going to need to ultimately pass your licensing exam once you graduate college. Okay? There you go. After you graduate, you have to take a national licensing exam to get your physical therapy license. So just because you graduate school with your doctorate degree doesn't mean you can practice as a physical therapist. You have to get a therapy license, like a lot of healthcare professions, like nurses, occupational therapists, speech therapists. We all have licenses. Okay? So when you're looking at schools, a lot of schools will list their pass rate percentage. They might say 98% of our students pass the licensing exam on their first try or something. So that's another statistic you want to look for. Also their job placement rate, which a lot of schools will post on their websites and stuff like that. And then the location of the school, whether you want to be close to home or maybe you want to go out of state for your college. So those are things to look at. Any questions on that? Because that's the important stuff for you guys when you're thinking about what you want to do, where you want to go. So, like I kind of mentioned at the beginning, your coursework, sitting in class, taking courses is about 80%. You do a lot of labs, a lot of hands-on, practice with your classmates a lot. You wear shorts and t-shirts to class, gym shorts and t-shirts, and you lay down on mat tables and you practice like moving people around and feeling what things are supposed to feel like normally and what things feel like whenever it's abnormal and stuff like that. But this is kind of a list of all the different courses you take, and there's probably a lot of words up here and you don't know what they mean. That's Duquesne's curriculum. I don't know what other schools teach, but it's pretty similar to that. So a lot of anatomy. I know you can take an anatomy course here in the high school if you're thinking about it. Not a bad idea. Anatomy is pretty much the basis of what we do. So, knowing everything about the body, the muscles, the bones, the joints, the nerves, the arteries, where they're located and what they do. So if you're thinking about having a career here, maybe an anatomy course in high school would be good. See if you like anatomy. If you don't like anatomy, you might want to venture away to something else, because that's the basis of what your schooling is. All right. Any questions on anything here? I could.
Do you have a high school course recommendations, like calculus, trig, or
You do. Well, it depends on your undergraduate education. Like for Duquesne, I had to take a calc class, and I had to take different types of English classes, but that was for my undergraduate, my bachelor's degrees, not for necessarily therapy school. I would say the biggest one in high school is anatomy, and I would, the sciences, biology, chemistry is helpful, especially with like physiology. This is a lot of chemical things. Physics, a lot of this is built on physics. Like kinesiology is pretty much physics of the body, so knowing how things move and how it relates to physics with levers and stuff like that, but that's getting to different stuff. Okay? And then the other 20% of your education is clinical work. So you actually are a therapy student. You go out to a clinic or hospital, let's say, and you are there for 6, 8, 12 weeks, and basically you're learning how to be a therapist. It's hands-on experience. It's hands-on learning. You can work in any of these different types of settings, which, that's one of the benefits of this field is eventually I'm not going to be able to work in the hospital for my whole life because it's a very physically heavy lifting job. So once I get older, I'm going to have to transition to a different type of setting, maybe an outpatient setting where you are, where you guys would go if you were getting therapy, or a sports medicine clinic, or maybe home health where you go to people's houses and do therapy in their house because they're not able to get out. Maybe to a school or preschool. There's a huge, huge pediatric population of physical therapy. It's very popular these days, so if you like working with kids and their parents, that might be a good idea for you. Aquatic therapy is in the pool, so you might see some of that. It's not as common around here in Pittsburgh, but I did one of my clinical works out in Phoenix, Arizona, and it's really hot there, it's really nice there, it's really warm there, so we spent almost all of our time outside in the pool with our patients doing therapy. Pretty awesome, if you're interested in that. A lot of government military positions, so if you're interested in working with military personnel after they come back from overseas, and it's pretty intense therapy, but a lot of people like it. It's very rewarding. A lot of amputations and stuff like that. These are some different therapy practice areas. This is by the APTA, which is the American Physical Therapy Association. It's just kind of a little bit repetitive of what that last slide showed, but these are their practice areas that they specify. This little star denotes after you get your therapy license and after you've worked for 2 years in a certain setting, you can get a specialty if you want to. So maybe, right now I work a lot with neuro patients or patients under neurology. So after doing that for 2 years, if I wanted to study, take a test, pay money for the test, I could get my neuroclinical specialist certification. So if you want to kind of expand your curriculum like that. For me, myself, where I work Monday through Friday, 7:30 to 4, which in the healthcare field is awesome hours. Nurses have to work a lot of nights and stuff like that. I don't work nights. I work 8 hours a day. I don't work 10 hours a day or 12 or 16 like some other professions do. And then one weekend day, so a Saturday or a Sunday, every like 5 or 6 weeks maybe, if you think of it, once a month. And that's specific to where you work. This is just for me. And when I work on the weekend, you make time and a half, so it's really good money. And then this is what the APTA lists as the professional behaviors for a physical therapist. Commitment to learning, interpersonal skills like we talked about, communication skills between patients and their family members, effective use of time and resources, constructive feedback, problem solving, professionalism, critical thinking, and stress management. It can be stressful at times, a lot of times, but it's all about your mindset and how you think of it and how you handle the stress. On your sheet are some of these references listed at the bottom. So if you need more information or if you're thinking of stuff, you can kind of look there. Just Google them and you'll find their websites. Now, who has questions? Yes?
So you said for your major you did like biology and like health science or something like that, didn't you say?
Correct.
And so was that just like the major that you had to choose through Duquesne to do your?
Well, I didn't really have a choice because it's Duquesne's program, so everybody in my class got the biology, health sciences degree and the therapy. You don't have a lot of, you have a couple of choices as far as like your undergraduate classes, which English class do you want to take or which calculus class do you want to take. But once you start the graduate professional physical therapy phase, your coursework is set out. So you take these classes this semester, these classes this semester. You don't really have a choice. Does
With
that make
other
sense?
programs, so like you could go like AT and then PT for your doctorate.
Right. So that's a good question. If you're thinking about athletic training, I had a couple kids in my class. You go 4 years, you get your athletic training degree. And Duquesne has a program like that, AT-PT. And then you go 3 years for your doctorate of physical therapy. So it's total 7. You can think of it as like the freshman admission 7-year program. And yeah, a lot of kids do that.
I don't know.
Absolutely.
So you said for the specialties, like what does that add anything more to your job, or are you just like seen as like better suited for certain situations?
And that's a very good question. Right now, it doesn't add much to your job or your degree. You know, after DPT, you can put those more credentials. You don't get any more money. And, you know, maybe it just kind of gives you people that you work with to look up to you if they have a question. So say they have a patient they're working with, maybe you're the orthopedic specialist, maybe they can kind of go to you and bounce ideas off. So it's not, it's something that's debated. Some people are like, oh, it's a waste of your time to do that, but other people think it's a really good idea. So, yeah, you're welcome. What else? That's it? Oh, sorry.
What
Go
made
ahead.
you want to do this career?
That's a very good question. So when I was a senior or junior in high school, I don't quite remember, I knew I wanted to work with people, and I knew I wanted to work in the healthcare field, but there's a lot of things you can do with that. So I called up a clinic, an outpatient clinic around Bethel here, and asked to kind of shadow or observe at their clinic so I could see what they did. And then that's kind of what like triggered my interest in it. And I just like, yeah, that's pretty much it. It's a good question though. If you are thinking about doing therapy, because that brings me to another point, a lot of schools, when you start the graduate curriculum, like the therapy school, you have to have so many volunteer or observation hours. So if you're thinking you want to do it, you can start now. I did a lot of my volunteer and observation hours in high school. You know, you can call up a clinic by your house and see if that's something that they are willing to do. And then make sure you keep track of them, because a lot of times schools, you have to turn in a letter signed by the therapist with you've completed so many volunteer or observation hours. Like for Duquesne, I had to have 250 hours by the time I started my 4th year of schooling. So it could be working too. Some people will work as a therapy aide, because as a therapy aide, you don't have to have a degree. And you know, it'd be good if you could get your volunteer hours and get paid for it. Yes?
So are you qualified to be an athletic trainer as well?
I am not qualified to be an athletic trainer. You would have to get You would have to go to the ATPT program, get qualified as get your athletic training degree, and you have to take a test, like a licensing test to be an athletic trainer. And then you could, if you wanted to be a therapist, you can. Because some people are just athletic trainers. They just stop after 4 years. They get their athletic training degree. That's what they want to do, and then just become an athletic trainer. But that's a good question.
So you said with the doctorate program at Duquesne that it was like 6 years, like all through the summer.
Yes.
Was that just because it was the freshman admitted program, or like can you do that at like another school? Just like choose to do it over the 2 years, or do they make you do it 3 years?
A lot of schools, you don't have a choice whether you want to do it in 2 or 3 years. Duquesne, remember, typically the education for the undergraduate and graduate therapy school is 7 years. And Duquesne scrunches it down to 6 years because once you start your 4th year of college, you go fall, spring, and summer. The summer is less intense, less credits, but it takes up your summer. You still have like 2 or 3 weeks off, but not like all the other schools have like months off if you just do a regular like undergraduate program.
So are you wondering if you can maybe condense a graduate school that was more like a 4+3 type
Yeah.
of thing? The one caution in that area is sometimes prerequisites are only offered in certain semesters.
Mhm.
So you might need Anatomy
Yeah.
1 before you can take Anatomy 2,
Mhm.
and you might not be able to take Anatomy 1 in the summer. It might only be offered in the fall. So you can sometimes get into a situation like that where just sometimes your schedule doesn't work out the way that you wanted it to. Same thing in college. They have more availability and some online options, but a lot of these things are very hands-on. So that's why sometimes you can't really condense all that much more than what they have.
It's a good point. And also, like during undergraduate years, when you have the summers off, I would take a couple like philosophy or sociology courses at CCAC, but you have to make sure that your school's going to accept those credits and they'll transfer over. And that would I just did that to lighten my workload for a couple of those other semesters. But you can also do that. All right.
I still have a couple more minutes.
Any other?
Why did you choose Duquesne?
That's a good question. We were just talking about it. So when I applied to PT school, I don't even know how many different programs, and I got into Duquesne and Slippery Rock. Those are my first 2 choices. Slippery Rock has a good program. I think they do 3 and 3, just how they split it up, but it's still 6 years total. And I went to Duquesne because it was closer to home. I live around here in Bethel, and I could still keep my job and work on the weekends. And also, I heard good things about their program and the education. It's a lot more money to go to Duquesne than it is to go to Slippery Rock. You know, now that I'm graduated and paying off my school loans and I'm looking at the financial stuff, which you guys don't have to worry about till later, but it was definitely worth it. Yeah. Class sizes, my class was about 35 or 40 students, so it's typical, like about, maybe a little bit bigger than what we have here. Different schools, like Duquesne had a limit as to how many kids they would accept per class, so it does kind of get competitive, especially now. There seems to be a lot of students who want to do it. So sometimes if you do the undergraduate degree and you reapply to therapy school, like the 4+3, you might not get into therapy school on your first time when you're applying. So I had a lot of people I had worked with where they got their undergraduate degree, they applied to therapy school, they didn't get in for whatever reason. Maybe it was grades or coursework, or they didn't have the prerequisite courses. They worked for maybe a year to wait and reapply. So if you're really thinking about it, I would push you more towards a program that's established to do undergrad and graduate together. And there's other schools like Westminster, Carlow. You go to their school for 3 years of undergraduate, and then they actually came to PT for the last 3 years for the therapy curriculum. We had a couple students in my class that did that. So, any other questions? No?
I think
Um,
something Let me
What-
have those back.
one other th-
Definitely email.
One other thing is, if you're thinking about it, if you want to see what the hospital is like, if you want to like observe or shadow with me, at AGH, you're only allowed to be with me for 4 hours. So it could be like 4 hours in the morning or 4 hours after lunch, kind of a thing. I had one girl last year. I gave this presentation, and she came and spent 4 hours with me and got to kind of see what I do. You know, go in and work with patients and stuff. If you're interested in it. And if you're comfortable in the hospital, because the hospital, some people don't like to see, you know, a little blood stain here or something like that. So you do have those kind of things. If you're looking to shadow or get some volunteer hours and you want to just email me and we can set something up. For sure. All right.
No other questions? Okay.
All right. Thank you.
Very